Good morning, good afternoon. My name is Pedro Alonso. I'm the director of the Global Malaria Program of the World Health Organization in Geneva. Today we're celebrating the World Malaria Day, and I'm very happy and honored to address and send this message to the malaria and public health community in Brazil. Also acknowledging the important meeting that a year from now, on the 28th of April, 2022, you will be holding in Rio de Janeiro, the Reunião Nacional de Pesquisa en Malaria, an important event for the Brazilian community and for all of us. But today, on World Malaria Day 2021, we want to acknowledge the extraordinary progress that the world has seen in the fight against malaria over the last 20 years. Globally, more than 7.5 million deaths have been averted. More than 1.5 billion malaria cases have been averted. Reductions in disease incidence and mortality rates have been remarkable. And we have indeed seen a historical, unprecedented progress in the fight against malaria. However, the World Health Organization has also called out over the last 4 years, through our World Malaria reports, that the progress was flatlining. And thus, the reduction in disease incidence over the last 5 years has only been of 3%. And consequently, we are far away, increasingly far away and off track of our globally agreed goals and targets represented in the global technical strategy adopted by the world in the World Health Assembly of 2015. So after a decade of extraordinary progress, we are seeing the limits of what can be achieved with the tools we have and the funding that we have. Because it is not just our progress in the fight against malaria that has stalled, it is also the funding that has flatlined. There are, however, some very positive news, even in these last years. The number of countries that are approaching elimination continues to grow. By now, it's 48 countries around the globe that represents about half of the malaria endemic countries that have less than 10,000 cases per year. A figure that we arbitrarily say puts a country within reach of eliminating malaria, of interrupting malaria transmission. Many of those countries are in the Americas. And many countries do actually manage to walk the last mile, manage to interrupt transmission, and indeed in the last 5 years, 10 more countries have interrupted malaria transmission. The ultimate goal for countries that eliminate malaria transmission is to be certified malaria-free. And I want to recall now and celebrate that increasing number of countries get the official WHO certification. In the Americas, in the last 3 years, Paraguay, followed by Argentina, and just a few weeks ago, El Salvador, a small country in Central America, fully surrounded by other endemic countries with porous borders, has achieved a major public health success. Having been a high burden country itself, did manage to interrupt transmission, maintain it for 3 consecutive years, satisfy the WHO criteria, and be certified malaria-free. So, a few extra words on the specific situation of the Americas and of Brazil. The Americas, we estimate, have about 700,000 cases of malaria every year. We estimate around 200 malaria deaths, and therefore, in comparison to the high burden areas of Africa or Asia, it has a relatively small malaria problem. However, the last years, since 2014, we have seen a steady increase in the number of cases and deaths, mostly, but not exclusively, driven by the situation in Venezuela. Specifically for Brazil, last year, the country reported about 153,000 malaria cases and around 50 malaria deaths. And while this last year we have seen some specific progress in 2019, pre-COVID, the truth is that right now Brazil has approximately the same number of cases as it did in 2013 or 2014. So again, a stabilization of the malaria situation, showing that over the last 6-7 years, the country has found it hard to make further progress. And in that context, we still do not have very defined estimates as to what the impact of COVID-19 may have had in the fight against malaria, specifically in the disruption of health services and the potential worsening of the malaria situation. But in World Malaria Day, today, we want to send a message of encouragement. Malaria can be eliminated. Even in some of the hardest places, some of the countries with the highest burden, they've managed to drive down the disease and eliminate malaria transmission altogether. I am very confident that Brazil is a country that it has the will, it has the technical capacity, it has the financial resources. It has a leadership position, not just in the Americas, but globally. And thus, Brazil embracing the concept of a Brazil free of malaria, Brazil eliminating malaria. And to do so in the coming years would be one of the most important public health achievements, not just for the country, but for the global malaria community, that would inspire all of those countries, particularly in Africa and in Asia, that continue to carry a huge brunt of disease. 400,000 deaths every year, more than 200 malaria cases, 200 million malaria cases every year. The example of Brazil, the reinvigorated effort to eliminate malaria, will inspire the entire world. I thank you very much. I wish you the best of success in your endeavor, and the World Health Organization, the Pan American Health Organization, will be there with you to walk this exciting, challenging, but important path. I thank you very much.